we have Miss Brinda here today with us. She came to me with complaints of pain in her knee joint. So apparently after getting an MRI, it's shown that she has sustained this ACL tear. So I've suggested her to get ACL reconstruction done. So Brinda is doing her masters here in genetics, VIT, yeah, and okay. And now she wanted to leave for US for her PhD in University of Texas. So she came to me and she wanted to get rid of this knee pain. So I've suggested her to undergo this arthroscopic ACL surgery done. So she got her done with her surgery 2 months back, and right now she's here with us. So let Brinda share her experience. Hi Brinda.
Hello doctor.
So how's your experience after your arthroscopic surgery? So first tell me, what happened before your surgery?
So 3 months before my surgery, I just had a twist, I believe. So I had a lot of swelling and knee pain.
Okay.
And I thought it's just a normal stuff, it will just go away. But then it's been like 2 months, then I came to you.
Okay. So how did this twist happen? Is it like, while doing some activity?
Yeah, I was just doing one of the yoga poses.
It's yoga posture, you're doing it by yourself or you are under some trainer?
No, I'm doing it by myself.
Okay, so this is a point to be noted.
Yes.
Where few certain exercises which are supposed to be done under a trainer's guidance. If you do it alone without proper guidance, this can happen.
Yeah. So that must be one of the reasons, I believe, where I twisted my knee and I heard a pop sound.
Okay.
So I didn't bother about it much. So I had a lot of swelling and pain, which eventually, worsened.
Okay.
And then I came to you, then you suggested me to go for an MRI.
Okay.
Since it's been like a long time. Usually a tear takes like 1 or 2 weeks to, go away. But then this was for a very long time. Then you suggested me to go for an MRI and it clearly showed that there was an ACL tear. And my problem was I came during a vacation period where I need to go to US for my PhD program.
Okay.
So you gave me a timely advice, like do it now because you have good enough time so that your healing procedure and recovery will be faster. So that was a very timely advice that I got, and I just went ahead and did it. My experience was, of course, ACL surgery is always painful, but then with proper physio and diet, I think now it's been like 3 months.
Exactly.
And I'm walking and doing all my things, and full recovery will take a little bit more time, as you suggested.
Yeah. So usually with ACL, you started walking immediately after a month.
Yeah.
Month's time without help of a walker.
Yeah.
We made you walk.
But before that, right, the next day of the surgery, I was made to walk.
You were made to walk completely, full weight bearing.
Yeah.
And after a month, you removed the support.
Yeah.
And right now, after 3 months, as I told you, you'll be jogging and you're able to climb up and down stairs without any support.
Yes.
And usually we ask the patients to resume with their sports. Usually these are sports injuries.
Yeah.
So usually it happens when you play some games like football, like some twisting injury during sports. But nothing happened with you, but it's just a wrong yoga pose, which made you land up with ACL tear. And so it's been 3 months, and 3 months I'm happy with your physio. But a little more effort should be put. So usually what people do is, like, after the surgery and after their recovery, what they think is like, we're comfortable enough, and they forget the physio. So my suggestion would be at least till 6 months. So as you told me, like you have to leave after 3 months. So it was a precious time where I cannot send you and like you can come back later. It's not that. What happens with the ACL injury is it slowly degenerates your joint. It's not repaired timely. So what usually people do, like they're walking comfortably. Only thing is they have little pain during certain activities. So they usually ignore it. Especially people who have good strength. With their muscles, they usually ignore it. So what happens is they come after a year or two with severe pain. By the time they reach the doctor and they get the consultation done and they get to know that there's complete ACL tear, will also observe a lot of cartilage damage, which happens because of the slippage. So for that reason, I've advised you to undergo the surgery as soon as possible, so that you will have proper physio time before you leave for US. When you leave for US, the access with the physio and the ortho doctors will be very difficult. So we are done with the complete program with your physio and all. So right now, as I told you, I'm happy with your physio, but I still want you to do a lot of exercises so that you'll revert back to normal. You can sit, squat, sit cross-legged, do any activity you want, and you can get back to your sports as soon as possible.
Sure.
Yeah.
Thank you so much for all your help, advice. It was really wonderful getting treated with you because of your timely advice. I took that advice timely because you gave it. Now I'm able to do my things, I'm able to walk. But yeah, as you said, I'll really struggle for my physio, and maybe the next time I see you, I'll be on completely.
Thank you. Thank you, Brinda.
Thank you.